Hello and welcome to this introductory presentation on the Training Advisory Council, or TAC group, through our DSW training project at KU. Just quickly, my name is Jennifer Babitsky. I am a graduate research assistant on this project. I will be hosting this training. I will also be hosting our subsequent Q&A sessions that I will talk about more at the end of this presentation. I will do my best to spell out email addresses and links as I can, but links and other additional materials will also be made available underneath this video on the YouTube channel. Before I begin, we all as a team want to thank you for your involvement and interest in being involved in this project. Our goal is to develop a training program for direct support workers in Kansas that reflects the needs and the expertise of people involved in the HCBS system, particularly care recipients and people who are involved with their care, such as family caregivers, direct support workers themselves, providers, care coordinators, etc. We are fully guided by the principle that comes out of the Self-Advocates Coalition of Kansas, or SAC, that there is nothing about us without us, which basically means there is not going to be any research or programs such as this training program that is not fully integrated with the lived experiences of those who are in the system themselves. So we want to honor your expertise as people involved in the HCBS system. We want to really fully welcome and just listen to your knowledge, because you know more than anybody, any researcher in the ivory tower of KU. So thank you for devoting your time, and let's get started. Also, if you have accommodations, we know that several people have very different needs, such as ASL language interpreters that need to be involved in future meetings, or just general language interpreters, screen readers, speech to text. Please let me know, and we will do our best to make those accommodations available to you. We will be transcribing both online presentations such as this one, as well as our online meetings that you will attend, and make those available to you if you so wish to have those. I have included a transcript of this video underneath the title on the YouTube channel, so you can access that there. I have also included additional materials that I'm referencing in this presentation in that link, or in that section of the YouTube channel. If you have trouble finding it, though, please don't hesitate to reach out to me and email me, and I will get those to you. My name is Jennifer Babitsky. My last name is spelled B-A-B-I-T-Z-K-E. And my email address is just my name, Jennifer_Babitsky@ku.edu. So please email me about any questions you have, and I will be happy to respond. Before we get too much into the content, I want to just briefly go over some terms and definitions that you will likely come across both in this presentation as well as in future meetings that we hold. Some of you are very familiar with these terms, so I apologize if this is redundant. But for those newer to the HCBS system, or those who don't necessarily interact with certain aspects of the system, hopefully this will help clarify some things. So when we refer to stakeholders, and we will refer to stakeholders a lot, what we're basically talking about is you, the person who is directly linked to the HCBS system, who is either using services or cares for somebody who uses these services. You have a special interest in the outcomes and the development of these projects. So you are our stakeholder, and we value your voice and knowledge. You're our stakeholders, and you're a valued part of this project. DSWs refer to direct support workers, also known as direct service workers, home care aides, care workers, paid caregivers, and any other terms that care recipients use when they're talking about their direct support in the home. And I should mention that's paid direct support in the home. We do recognize that family members or natural supports can be paid under, newer policies in Kansas. However, when we're talking about these DSWs, we're talking directly about like formal, non-family paid caregivers in the home. KCART and KCART Oasis. These come out of the Kansas Center for Autism Research and Training. That is what KCART stands for. And Oasis is their online applied system for intervention skills. So this is a training program that was developed from a previous research project that deals particularly with trainings of DSWs who work with those with autism, who are on the autism waiver, or related disabilities. And so this set of trainings is already in place. Our role as TAC members is to just kind of improve, review, and bring these trainings up to date for modern concerns or up to present day concerns. LTSS stands for Long-Term Services and Supports. I'm sure you're well aware of that term. Waivers refers to all the disability waivers under the state of Kansas's HCBS program. And so these waivers include the autism waiver, brain injury, frail and elderly, intellectual and developmental disability, physical disability, severe emotional disturbance, and technology assistance waivers. PCSP is a term that we probably won't use in conversation very much, but we will use it probably in our written materials. It refers to person-centered support plan. And all of our trainings are, coming from a place of focusing on the person first, using person-first language, plain language, and developed with the care recipient in mind. ADLs and IADLs refers to activities of daily living and instrumental activities of daily living. I won't go much into what those are at this point, but we can address those questions. If you have those, please email me and let me know, and I will clarify any further terms. So you have expressed interest in being a part of our Training Advisory Council. As we move forward, just to make things a little shorter, I'm going to refer to this as our TAC group. This is an integral part of our project that involves so many stakeholders involved or who have experience in the HCBS system. So this can include service recipients, direct support workers themselves, providers, family caregivers. We've had some case managers or former case managers, care coordinators that want to be involved. So we really just welcome all these experiences on the TAC committee or the TAC council because you are really going to help us develop some great quality programming and training for our DSWs in Kansas. You offer your expertise, and the ultimate goal is to improve DSW competency, care outcomes for recipients, and to improve DSW satisfaction and retention. Some of the things we've heard in previous research with the HCBS community and support workers is that they felt that they needed more training and they didn't know where to access it. And so this is really why we're developing this project, is to not only support the training efforts of agencies that are already in place, but to provide training for those self-directed workers who may not have a strong support system underneath them. The Training Advisory Council will also be working closely with other departments at KU, WSU, and KDADS to develop this program from the ground up. So again, we are so just excited that you want to be a part of this, and your knowledge is going to really make this just a wonderful program. So our overall purpose of this project is to deliver 75 hours of DSW training across 23 to 27 topic modules. And these will be delivered online, so they're fully accessible to DSWs in Kansas no matter where they live. The other part of the training will be, again, to update the trainings, the 9 intensive K-CART trainings in the OASIS online learning system. And this is particularly for care recipients on autism waivers or with related disabilities. Another aspect of this project is that we are going to develop ongoing reports, not only to our funders, but to the state of Kansas, to inform them about what we're doing, and to provide recommendations to the state about what they need to be doing to support our efforts, not only while this project is active, but after the project is over. So this project is multifaceted, it's large, and it's multidisciplinary. We are funded through the American Rescue Plan Act, particularly FMAP funds. And so the American Rescue Plan Act, the acronym is ARPA. You may have heard of that in your various experiences in the system. And this is funds for enhanced federal medical assistance percentage. And basically these funds are coming from the government through the state to help support HCBS programs. And so a full kind of portfolio of where these funds are coming from and how they're being used is available at the link provided on this screen. I'm not going to spell it out here, but I will provide it in the information below the title of this video. But if you cannot access that, please email me and I will get that link to you as well. We are partnering with several departments at KU, including CRADO, the Center for Research on Aging and Disability Options. That is the department that I'm a part of. The Lifespan Institute, which includes Research and Training Center on Independent Living, and the KU Center on Developmental Disabilities. We are also partnering with the KU Med Center. And the Medical Center is really going to inform us about the different medical aspects of our trainings, because as social science researchers, we are not that informed on the medical aspects. So the Center for Autism Research, Department of Occupational Therapy, and Alzheimer's Disease Research Center will be providing that medical knowledge that we need. We are also partnering with Wichita State University, mainly through their Training and Technology team, or T3. They are going to be developing the actual online learning management system that all this training content will be uploaded to. They will be in charge of making sure it's user-friendly and engaging, and to deal with the technical aspects of the delivery of this program. We have subcontracted with the Self-Advocate Coalition of Kansas, or the SAC group, as I mentioned before. Their voice and their knowledge and their expertise is so valuable to the development of these programs, and they are going to really inform what they experience as the most important training needs of DSWs in the state of Kansas. Kansas Department of Aging and Disability Services is also part of our project, and then, of course, the Training Advisory Council, of which you are a part. Here are the principal researchers on our project. Carrie Wendell Hummel is the principal investigator. She is the one that developed this proposal, this plan, secured the grant for this project. And so she's really the lead. She will be leading all of our Zoom meetings as well. Sandy Heston Pewitt is our HCBS project manager at KDADS. And Laura Swartzendruber is our project manager, also through the department, the CRADO department at KU. I provided their emails and phone number for Carrie Wendell Hummel here. If you are unable to see that in this screen, please email me and I will make sure that you have that information. This project is divided into 2 parts, basically. We have our 75 hours of DSW trainings. These trainings are coming from a person-centered, strengths-based approach. So what that means is we are designing all of these all of these training modules to keep the focus on the care recipient first and what is good for them, from their voices, from their expertise. We are coming at it from a principle that care recipients have so many abilities and can advocate for themselves, and we are listening to what they are telling us is important. So we are designing that within every training. We're also integrating cultural competence throughout each of our trainings as well to make sure that we are addressing the needs of every care recipient, regardless of their ethnic or racial background, socioeconomic background, religious preferences, and so on. Each module will be developed and reviewed and kind of edited by the TAC team and our various stakeholders involved in this project. So again, this group, this TAC group that you're a part of, is going to be instrumental in developing the content of the training before we even put it out for testing. Once we develop the content, we're pretty happy with it. It will go out to testing to actual DSWs who have volunteered their time on the project. They will test out each of the online modules and provide feedback to us about what works, what needs to be improved, etc. And then we will take all that feedback. We will reevaluate the things as a team as well. And then we will develop the kind of the live final version of the training module and give that to our to the state for live disbursement, I guess, or dispersion. Part of any research project is to prove to the state and to our funders and to various other stakeholders that what we're doing on these projects is effective. And so we are going to offer pre and post test competency evaluations to all DSWs who complete these trainings. And we are measuring whether they are improving their skills and knowledge on that particular topic. But not only are we going to be evaluating DSW kind of awareness or increased skill sets, but we're also going to survey family caregivers, care recipients, providers as well, about how they experience the improvements to the DSW knowledge and skill set. So, for example, we will send out surveys to care recipients and ask them, since your worker took this training, what have you noticed? Have there been improvements? What's not working so well? Have there been things that aren't improving? We're going to take that feedback and bring it back to our training modules to assess the things that we need to improve as well. I think I mentioned that the online learning management system is developed by WSU's T3 team. And this project is a large project. I mean, we've got 75 hours of training. So what we're designing is a training that is going to be developed and released in phases, and I will talk about that more once we get to the timeline. So as I mentioned, the other half of the training is our K-CART OASIS training. These are 9 trainings that will occur over 18 months across the entire state, but particularly we're focusing on underserved areas of the state. These trainings will be 40 hours, both hybrid, online, and in person. Again, these are already in place. Our role on this project, or our role on the K-CART OASIS training, is to review the trainings and to offer feedback about updates, improvements on what's already existing. So this will be a less intensive focus, I guess, or less intensive aspect of our project than the 75-hour DSW online training is. Particularly the K-CART OASIS trainings will be using applied behavioral analysis as the kind of intervention, which is designed for content and skill competency. Linda Heitzen-Powell is basically in charge of our K-CART OASIS part of the project. And she mentioned specifically that if anyone on the TAC team has had direct experience working with previous K-CART OASIS trainings, she really, really encourages you to come to the next meeting, which at the point that this video is being made is September 26, 2023 at 10 o'clock. And please bring your feedback and ideas about things that you see that need to be improved for the K-CART OASIS trainings. So our overall timeline on this project is basically going to be done in phases. I'm going to explain this graphic a little bit. So right here we have the project started July 1st, 2023. It will end March 31st, 2025. Okay. in each of these quarters, quarter 1, 2, 3, and so on, starts at July. So we're basically taking 3-month increments on this timeline, starting from July. So it doesn't match like a financial quarter, if you will, necessarily, or an academic, calendar year quarter. So in July, we developed and evaluated some initial surveys. That's already pretty much been completed at this point, but we will continue to develop further surveys of other stakeholder groups throughout the project. Starting here, I'm going to skip down to Group 1 modules. Basically, the Group 1 modules are starting basically now and really hitting it hard in September. This is where we're going to be reviewing the first 4 to 5 training topics, reviewing the content, and then offering feedback and adjustments to that before we put it out into the testing phase. The K-CART trainings, just right above there, we will start in we will start that in October, delivering those adjusted and amended K-CART trainings to the K-CART Oasis team. So in September, we're starting Group 1 modules, and Group 2, or in September, we're also starting on those Group 2 modules, so the next 4 to 5 training topics. We'll be working that from October to December with deliveries of the testing portion in, say, I think in like late 2023, with the live versions going out early 2024, so January or 2024, and so on. So you can see that Group 3, 4, and 5 will be introduced in phases. We are offering a catch-up period in October through December of 2024. Inevitably, on these projects, there's going to be delays or things that don't go quite according to plan. So we're allowing some time to kind of tie up loose ends. We will have final revisions on trainings at the end of 2024, first part of 2025, and then the project closeout from January to March 2025. So when I'm talking about developing or looking at groups of trainings in phased rollouts or phased, introductions, each month we begin a new group of 4 to 5 training modules. The entire process of development through the release to the state is going to take about 6 months, all told. So for example, if we start the Group 1 projects or Group 1 training modules, so that would be the first 4 to 5 training modules here in September, basically this will take the entire process or the entire time of the rest of 2023, with a rollout expected in January 2024. Okay, so it'll take about a month or 2 on each of these. Content development, then the online management system development. So that would be WSU's role, is to develop that as an online training. Then we'll pilot it with DSWs, revise and finalize the training topics before we release it to the state. Again, that will take about 6 months. And the final part of our video is to give you an idea of the topics that we've covered so far. So there's a lot here. I have provided a link to the copy of the proposed topics to date, which is also underneath the title of this video. We also discussed on our first meeting in August of the TAC team about some feedback for additional potential training topics. So I will address those at the end of this series of slides here. So topics 1 through 4 are the general introduction to the HCBS system, history of disability services, communication, and professionalism and ethics. Now, although we have numbers listed here, 1 through 4, these are not necessarily the order that we will be reviewing them in our different groupings on the timeline. We are going to ask you as TAC members what you think are the most important topics to cover in each sort of rollout or each phase. So the introduction to the HCBS system, gives the purpose of Medicaid, HCBS programs, the description of the waivers, the difference between Medicaid and Medicare, which we know a lot of people get confused about, the role of person-centered care planning, CMS final rules, and the self-directed care model. Okay, and we know there's a lot of confusion about self-directed versus agency-based, person-centered planning. So this module or this topic will really cover that. All of these topics that I'm discussing here are informed by feedback from DSWs themselves and our SAC team members. We're covering the history of disability services, the shifts from institutional to community-based care, the expansion of disability rights, which is at the heart of our training projects, and then institutional historical trauma in terms of, interactions of care recipients with different institutions, and also trauma-informed care services. Topic 3, communication, discusses professional, respectful communication using plain language, person-centered language, focusing on conflict resolution in positive and healthy ways. This could include also just conflict resolution, not only between the worker and the care recipient, but also between the worker and caregivers and other people involved in the care of HCBS recipients. There's a module on professionalism ethics. This is what we have as module or topic 4. This educates on HIPAA and other laws and legal regulations that apply to DSW work, maintaining confidentiality, respecting individual and family rights to privacy, dignity, and boundary setting. Self-determination is topic 5. This describes what self-determination is, the self-advocate perspective, evidence-based support strategies, and empowering individuals to advocate for their needs. Topic 6 is supporting decision-making. So this is where we are helping create strategies for workers to support recipients in making their own informed decisions about their care. And then topic 7 is abuse, neglect, and exploitation. So this is recognizing the signs of abuse, neglect, and exploitation, knowing how to report, when to report, who to report to, and best practices basically in the reporting process to understand or to balance victims' rights and safety, as well as making sure that they are protected. All of these topics 5, 6, and 7 have been recommended by SAC directly and also supported by the DSW Workforce Core Competency Projects. Starting with topic 8 and throughout the rest of the training topics that I'm mentioning here. These get into more specialized topics. We're moving away less from generalized to the more special topics that regard specific diagnoses or waivers or communication needs, etc. So topic 8 is dual diagnosis. This covers both mental health diagnosis as well as medical diagnosis, cognitive impairment diagnosis, etc. This topic will cover strategies for behavior management and how to recognize the need for professional intervention beyond the care worker. Topic 9 specifically focuses on dementia caregiving. It is informed by our Alzheimer's medical team, the impact of dementia on cognition, memory, and behavior, etc. Topic 10 is engagement and community participation. So this topic is an overview of the value of social networks and community engagement for health and functioning. One of the things we saw that came to light, particularly during the COVID-19 pandemic, with all the quarantining measures and the different safety measures that were put in place, was the sense of isolation among so many of our care recipients and even caregivers and workers as well. And so the need for maintaining social connections is so important, and this topic will cover that. Topic 11 is principles of behavior. And so this will be really informed by the medical team, as well as our social welfare team, as well as our K-CART OASIS training using the applied behavioral analysis strategies. But this is working on recognizing different behaviors and why they're happening, learning how to manage and those behaviors in positive, person-centered ways, how to record and to document behaviors. Topic 12 extends this topic of behavior principles to positive behavioral supports. Again, really relying on K-CART OASIS trainings that are already in place, how to de-escalate problem behaviors, and this will really have an emphasis on autism and other developmental disability waivers. Topic 13 focuses specifically on brain injury waivers. We will be really discussing a lot of specific medical issues associated with this, as well as cognition, memory, and strategies for managing BI behavior. 14 is complex medical conditions, and this deals with dealing with complex medical conditions. So we know that many of our care recipients also struggle with diabetes, hypertension, asthma, chronic health issues, skin ulcers, etc. And so we really want to make sure that we are attending to all aspects of consumer or recipient care. Topic 15 is adaptive communication. This will be overviewing different types of communication devices and methods, particularly how to understand and interpret nonverbal cues, working with hard of hearing individuals, and using person-centered, respectful communication guidelines. Topic 16 covers fall prevention and safe mobility, as so many of our care recipients do struggle with mobility issues. This topic will help DSWs reduce fall risks, use mobility devices properly, as well as learn how to request and advocate for their care recipient to have mobility devices if needed. Topic 17 refers to safe transfers and lifting. So this includes the use of equipment, including transfer boards and Hoyer lifts, which some self-directed workers may not get specific training in. It depends on, what sort of supports they have in place. 18 deals with medication administration. This is pretty self-explanatory, but it also deals with understanding how to deal with care recipients who may not be complying with their medication requirements and how to do that in a positive way. Topic 19, using medical devices and procedures. This provides an overview of commonly used medical devices in the LTSS communities. This can include feeding tubes, oxygen tanks, etc. This will review how to assist safely and also how to understand the rules and regulations regarding the use of these devices and where to go if additional assistance is needed. Topic 20 is focused on infection control and prevention. So this is an overview of preventing and treating infections, as well as best practices to maintain good hygiene and sterilization of the environment of care recipients. Topic 21 deals with safety and emergencies, and this really just deals with preparing DSWs for dealing with emergency situations such as power outages, or as we found in COVID, quarantining issues. This could also deal with working with service animals as well. Topic 22 deals with social determinants of health, and these social determinants of health are topics that are identified in the field of sociology as things that we wouldn't necessarily think had a direct link to health outcomes, but it does. Research has found that. So we see that socioeconomic status, income, in other words, education, housing, food security, social networks, transportation, all of these can impact one's well-being and health. Topic 23 is supporting employment. This is a huge factor right now in the HCBS system, particularly for DSWs, because many self-directed workers who work in the self-directed area of the system may not have the agency support that they need a lot of times. And so this is a topic that focuses on ways that DSWs can support employment by engaging people supporting their own working goals as DSWs, but also supporting the goals of having care recipients being ready to work for wage labor. And so this will really be informed by WORK, the program WORK in the HCBS system, just preparing people for employment. And then finally, topics 24 through 27 are going to be open topics. So these are the topics that we have not yet identified that we're really relying on you, members of TAC, as well as our other stakeholders on the project to let us know what needs to be added. Just to give you an idea on some feedback from our initial meeting in August about some additional topics that we could look at. These included, addressing internet safety issues and technology use among care recipients is, a very present-day topic given the prolific use of iPhones and tablets and whatnot, internet-based technology. There was a recommendation to address sexuality and sexual health among HCBS recipients. Again, maintaining culturally competent practices, including respecting religious preferences and other cultural preferences for care. Nutritional support is not something that was identified specifically in the topics mentioned previously, and so there was a recommendation to include that either within an existing topic or as a separate topic. There was an emphasis on making sure we use people-centered, person-first language, plain language. There was a recommendation to have a section that addresses legal issues in dealing with things like guardianship and conflict resolution between stakeholders involved in recipients' care, as well as legal issues involved with dealing with law enforcement and maintaining environmental safety. Particularly for areas where maybe there's just higher crime rates or other things that might be concerning to the safety of care recipients and their workers. There was also a recommendation to include a section on making sure that DSWs know how to care for themselves when they are feeling burnout from their care responsibilities, but also developing healthy boundaries between themselves and their care recipients. And finally, money management and ethics around managing finances is another aspect that our team suggested we focus on a bit more. So these are all these last topics that I mentioned here. We are going to evaluate those in detail and think about them a bit more and come back to our next meeting in September to see if there's a way that we could integrate those into our existing topics or if they need to be their own separate topic. So that is something we will also discuss in our next meeting. I've covered a lot in this training video. So we know that people will very sure have questions about this. So I'm going to be hosting twice weekly Q&A sessions via Zoom. I will log into Zoom, and anyone that has a question can log in and get those questions answered in real time. So I will start hosting those starting September 6th. So I will host them at 2 different times. I'm going to offer Mondays from 6 to 7 for those that need an evening hour to log into Zoom and ask questions. That first meeting on Mondays will not happen until September 11th due to the Labor Day holiday. So we won't have one on September 4th. But the following Monday, I will be on the Zoom link. Or if you can meet during the day, I'm offering a Zoom session, Q&A session on Wednesdays from 2 to 3 p.m. And that will start next week, September 6th. If you can't make either of those meetings and you still have questions, please don't worry. Just email me at jennifer_babitsky@ku.edu, and I will be happy to answer those questions or set up another time to meet with you individually. Also, feel free to forward this video to anybody else involved in the HCBS system that you think might be interested in being involved in the development of these training materials for direct support workers in Kansas. I will make sure that I connect with them and get them all the required materials and invitations that they need. Also, since you've expressed interest of being on the TAC group, we do expect TAC members to attend TAC meetings monthly. They occur on the 4th Tuesday of every month from 10 a.m. to noon, and it's through a Zoom meeting. So it's an online meeting. You should be receiving an email with an Outlook calendar invite on that pretty soon for the next TAC meeting in September. If you need a different calendar invite for like Google or iPhone, Apple, please respond or just please email me and I will get that version sent to you. And again, if you have any questions in the meantime, please don't hesitate to reach out. Thank you for reviewing this training, and I look forward to working with you very soon.